Actually, this session is supposed to be presented by IDF President Dr. Shaka Sarakat, but he's in Dubai attending another meeting, so I'm presenting on behalf of him. But it is very sensitive issue that I'm about to present it to you. I'm about to open a can of worms, and I'm pretty sure you have many questions after my presentation. But now IDF's been going well, but at some point they were in trouble, but now they are in deep trouble. So as a member of associations, you all have every right to know how your father's doing. If your father's not doing, you could kick him out of the house. So let me start with IDF in the coming years. What are the global priorities? Just to introduce who is International Diabetes Federation, we are 60 years old, and then we're going into 66 years old this year. Our mission is to promote diabetes care, prevention, and cure worldwide. It is an umbrella organization of over 234 national diabetes associations and in 168 countries and territories. It is responsible for more than 415 million people living with diabetes, and we are representing their rights. Associated with the Department of Public Information of the United Nations and its official relations with the World Health Organization and the Pan American Health Organization. What are the IDF priorities, as you've seen in my title? It is better and stability of the IDF financial status. I'll go into details in every area. Balance the growth of the both regional, global and regional regions. Building global education projects. Building humanitarian projects. Better worldwide recognition of IDF. So let me go into the first issue. Current state of IDF financial situation. Probably all of you wanted to know how IDF is doing, but this is probably the first time we are really transparent about IDF's financial situation. We have currently 3.5 million euro annual structural deficit. You know what that means. We have a deficit of 3.5 million euro. Corporate funding, starting from 2012 to 2015, reduced from 3 million euro to 1.26 million euro, indicating that we continue to lose the projects it's been carrying out under IDF's umbrella. In beginning of 2012, we had 23 corporate fundings. Now it is down to 11, and within the next 3 years, it'll be 0. We're completely broken. The sources coming from corporate partners. And there's no new corporate initiatives been made in past 3 years. And we are dependent on Congress income for unrestricted fund. Unrestricted fund means this is what the operation cost and the salaries for the staffs and households. And there's a significant reduction of Congress income. You all know why, because of the implementation of Sunshine Law starting from North America. Now it's implementing all over the world. So many doctors are restricted going to the Congress, and which were supported by the pharma companies. More than 1 million euro in 2016 budget deficits will come. Board, you probably question why board approved 1 million euro deficit in the budget. In order for IDF to operate, we have to approve them, but we approved based on almost 1 million deficit this year. So if we're doing fine job, we lose 1 million euro for this year. Hopefully, our board, the current board is very strong to save some money, so hopefully we'll come with a balance, no loss. So that million euros deficit will come because high salary and benefits of the house staff. We used to have close to 60 employees there, but now it's down to 23. And we also even changed the structure to save the money for IDF. And high operation costs are also embedded there. High operation costs mean even the leasing a space, IDF space in Brussels is about €250,000 per year. That's just for rental. And there's all other things, electricity, water bill, insurance, all other things embedded in and it'll accumulate easily up to $1 million per year. So leave the financial issue. I'm pretty sure some of you will have a question me why we are in deep trouble, and I'll say to that. But next area is that current growth of both global and regions. All of you know, previous speaker also said that how well they are doing in the individual countries. Member associations are doing. Just like UEDA, you're all doing perfect job. You're doing an education program, you have a clinical, the teaching, the postgraduate courses, so many things you've been doing it. But are we supporting enough? IDF supporting enough member associations grow bigger, faster, and effectively? Probably your answer is no. This is our focus will be in the future. Give more opportunity for the region, the member associations to grow. So we got to have a balanced growth in both region and global, not in just in global. At the moment, global budget spends, global office budgets, 94% of all the income comes in. Only 6% goes to the 7 regions. I don't think that's right, and I don't think it's fair. So no or low existing regional office supports. You probably received the letter that we're going to terminate all the regional managers. That's for the restructuring purpose, but at the moment you don't have regional managers. So you have a low monetary support. Maximum you'll get about €30,000 per year to run regional offices on the addition to the project if you wanted to run with this kind of money. And no project supposed to be made in no region except the some in European region. No encouragement of region and local projects. If you, at this moment, based on Articles of Association and then standard operation procedure, you cannot do the fundraising locally and then run the project, but we'll allow you to do that in the future. So you could do the local project, even do the fundraising your own. So it'll be more flexible. So IDF should become a more supporting tower. This is what I clearly said it to all of you during my president-elect speech. IDF not going to be controlling tower spending 94% of the budget. That's not right. There will be the more supporting tower, spend the majority of the budget to each region and the member associations to become stronger. Without a child being strong, the parents cannot sustain. You all know in Asian culture, when you get older, children look out for you, financially and health-wise, right? It's the same principle applies. So member association has to be stronger in order for IDF to be a strong organization. So IDF regions allowed more independent activity in the future. So look for that. And then building global education project. This is current President Sadokati's goal, is creating a global diabetes school. All of you has a diabetes school or diabetes the education program in each region and member association, but we're going to globalize and then form what is called the school. Professor El Saidi is involved heavily in this project, and he'll be probably the leading man to build this school. So it is website is learning. I'm not going to give you the details, but you may ask Professor El Saidi after my talk if you have any questions. He knows more in this practice than me. And support both professional and patients. Member association involvement is very critical. When you say the education, there's no one single education will be successful in each member association. So flexibility has to be there, and the member association involvement is very critical for success of this school. Regional culture, religion, social structures, and economic standing must be considered for the lecture materials. Without all these issues, that school will fail. For example, education models for the low income. Let's say we have the best model, standardized model for the education. You know that model is going to apply to the area where people cannot even afford to eat. You give them insulin, these people it doesn't even have anything to eat. Sure enough, this person will become a hypoglycemia and probably coma and death. So all that thing has to come with all ancillary stuff like food supplies and all other structures. Okay? And pilot studies necessary. Maybe school is formed instead of going full-blown at full speed at the beginning. We'll probably start from one region or one member association whether these school programs works properly. And another area we are focusing is building diabetic foot project. Currently, we are linking with some other associations to doing it, but honestly, we've been abused by this organization, so we are forming, under the IDF, we're forming committee, and then we are forming the diabetes project, which will be run under the IDF umbrella. And one of the areas is the link with high-quality education institutions such as Western University Health Science Center in California. And then Dean is willing to go with us with this project. And he's also a very close friend of President of the United States, Obama. So once this project started going, we could do a lot of political links to get helped in financially or in policy-wise. So another thing is in this diabetic project, we'll developing a campus training program. Some of the PI to come to this university and get trained and conduct the international level of researches together. Also, we just nominate one of our board members. He's the regional chair of Osaka, Dr. Ahmad Ibrahim. He lives in Dominican Republic and he's in charge of a superintendent of a hospital, also diabetic foot center, so he'll be leading this team. Another area is the building diabetic retinopathy project. It is multi-centered early diabetes screening project. It is starting from the Western Pacific region. Well, they developed the fundoscopy, very simple fundoscopy, just diagnose normal, abnormal in primary care setting. Simple design, but the reading is also done by the website going to the centralized area. Currently is in China, and computer programs reads whether this person is normal, abnormal, and the read it come right back, normal, abnormal. If you have normal, go see the ophthalmologist. And currently we are studying pilot studies. Professor Al-Said is in scientific committee, and our vice president Akhtar Hussain is sitting there. He joined arrived very late last night. He's also steering committee member with myself. So pilot study will study with China, Bangladesh, and North Korea. Then hopefully this will be disseminated in 234 member associations, the area where they are locating it. Another one is, this is the baby I'm starting to work on it, and then hopefully it'll be ready to go when my president study, which is the building humanitarian project. We call Diabetes Clinic Habitat Project. Short name is Diabitat Project. This is very similar to what ex-president of the United States, Jimmy Carter, is doing. He's going on the poverty area, building homes for poor people. So this concept is very similar. We are building clinics in poverty area. In that clinic, the clinic will provide the free of insulin, anti-glycemic agent, and basic things need for people living with diabetes, like a Lancet, alcohol swab. Also, we could do the screening of diabetes. We'll provide the hemoglobin A1C machine, which uses cartilage. And I already talked to people to develop this unit in Korea. Also, Lancet, iSense developed Lancet. They are willing to provide the Lancets and glucometers and hemoglobin machines for free of charge. So we'll hopefully have a fundoscopy there, simple fundoscopy diagnose normal, abnormal, basic screening equipments like hemoglobin A1C machine and glucometers. Also, in hopefully conducting diabetic the screening as well as gestational diabetes. So all those basic screening, also basic care for people who can afford to go to the, has access to medical care or limited access to Medicare. So they will provide those kind of humanitarian need for people living in a poverty area. Also, one other important thing is that facility is not going to be big, but effective and efficient space to also provide the local educations there. We have a website based on Global Education Center, but locally people will be educated there. But important thing is the involved member association. Like UEDA probably, let's say we have one Aswan, UEDA will be in charge of this center. And then IDF will do all the fundraising as well as the supply be given to you in free of charge. But UEDA has physicians, they could kind of contribute your time 1 hour per week and look out for this center, also helping people. So we need your help. We all have to go together. Another important center is this center, Habitat will be used as a focal and contact point in case of emergency. In Asia region, there's a lot of natural disasters occurring as well as a human disaster. You all seen it in the Syrian region. So hopefully, I promise with IDF, the friends, that I wanted to build the first center nearby the Syrian border to help people there. But I'm willing to pay for all the expenses go